So to our top story tonight, and worrying new revelations discovered by this programme about the growing crisis in Britain's ambulance services. An NHS whistleblower working inside one trust has told the news desk that up to 3 people a day are now dying while waiting for an ambulance, some as they're still on the line to 999. And he says extreme staff shortages left one city, Chelmsford in Essex, with just one ambulance on call throughout an entire night. Our revelations followed dire warnings this week that ambulance service trusts across the country could fail entirely this summer, as waiting times for 1 in 10 patients reach a shocking 2 hours. Our correspondent Amelia Harper has that exclusive story, and she joins me now from one hospital in central London. Amelia, what have you found?
Well, Tom, this shocking account details the pressures that the NHS service and ambulance services are still under. And this testimony echoes pictures that we are seeing across the UK as well. This whistleblower from within the East of England ambulance service says that ambulance delays mean that patients are dying on average a day at a rate of 2 to 3. That may be more, of course. And they say that in some places, in emergency situations, they are waiting over 4 hours. And this echoes what we are seeing nationally. The latest NHS England data shows that ambulance trusts are missing targets continuously in urgent and emergency situations. Our whistleblower says that these ambulance delays are costing lives.
We're looking at sometimes in excess of 45 minutes to get an emergency ambulance for somebody who isn't breathing, and the hospital delays are literally killing patients. I mean, it depends on different counties and different areas, but I would say at least 2 or 3 people die a day waiting for an ambulance. And this is, you know, the huge concern. Because the ambulances are all stuck at hospital, you know, we've got 15 to 20, sometimes 30 plus ambulances waiting to offload in accident and emergency. So we've got a full A&E and then a further 30 patients in ambulances in boxes outside.
And Tom, this echoes a national picture. Only on Wednesday we heard that the West Midlands ambulance service was at risk of collapse come the summer. Their nursing director, Mark Doherty, says that this was a titanic moment and that by August they fear they will not be able to respond to 999 calls. Our whistleblower says that it is the time taken to reach patients that is what's costing lives.
We have had many cases where paramedics have waited for an ambulance and patients have stopped breathing on them because they're so long waiting for an ambulance that it's just too late. I remember waiting on a scene for a backup for over 4.5 hours, and that's for someone with chest pain. I've been into the control room and witnessed over 150 calls waiting to be answered. That's 150 999 calls at times that have been waiting to be answered. The other night shift we had 1 ambulance and 1 paramedic on a car for a population of over 200,000 to 300,000 people. We are unable to provide a service that we should be providing because of the delays and because of the amount of people that are calling 999, and so much of it is unnecessary 999 calls.
I mean, it's really shocking stuff that we are hearing there, but what does the government say about this? Well, the Department for Health has again thanked frontline NHS workers. They say the NHS has allocated £150 million of additional funding to tackle this. The East of England Ambulance Service says we've been working hard with partner organisations to reduce waiting times. But Tom, let's take a dive into this national picture, looking at emergency times for incidents like heart attacks, strokes or sepsis. Now, the target response time for these what are called Category 2 calls are 18 minutes. However, this has rocketed over the last year. The average response time was actually 51 minutes, almost 3 times the target. National guidelines, these are targets, state that 90% of these Category 2 calls, so for heart attacks, sepsis, etc., should be attended within 40 minutes. But what was actually happening, the actual time was taken was just under 2 hours. Again, 3 times the targets there. Now, if we look regionally, Tom, the southwest has seen a particularly bad impact from these ambulance delays. If we say take a woman who was in the late stages of labour, it should take an ambulance 2 hours to arrive. In actual fact, it took 15. It's really clear, Tom, that from this testimony from this whistleblower that this is not just a problem in the east of England, it is nationally, and it is worrying staff and patients.